Ευχαριστούμε που είσαστε σήμερα μαζί μας. Είμαι ο Γιάννης Πένας, είμαι ο ιδιοκτήτης της εταιρείας HNFC Academy. Η εταιρεία είναι ο αποκλειστικός αντιπρόσωπος για την Ελλάδα και την Κύπρο των εκπαιδευτικών προγραμμάτων της Αθλητιατρικής Ακαδημίας Αμερικής, της National Academy of Sports Medicine. Και μέσα σε όλα αυτά τα ωραία πράγματα τα οποία κάνουμε στην Ελλάδα τα τελευταία χρόνια, τα οποία έχουν να κάνουν με την εκπαίδευση, προσπαθούμε, ειδικά αυτόν τον καιρό που οι περισσότεροι από εμάς είμαστε κλεισμένοι μέσα στο σπίτι μας και θέλουμε να βρούμε τρόπους να εκπαιδευτούμε αλλά και να έρθουμε κοντά ο ένας στον άλλον, προσπαθούμε να κάνουμε κάποιες ωραίες δωρεάν ημερίδες και να μιλήσουμε για πράγματα τα οποία θα μας φανούν χρήσιμα τώρα με αυτήν την καινούργια ευκαιρία που έχουμε με τον κορονοϊό, αλλά και στην πορεία. Έτσι λοιπόν σήμερα έχουμε μαζί μας την Wendy Batts από την Αμερική. Είναι Master Trainer της NASM και είναι καθηγήτρια στο Πανεπιστήμιο της Καλιφόρνια. Την έχουμε μαζί μας καθώς είναι ειδική πάνω στο Corrective Exercise και θα μιλήσουμε καθαρά για αυτό το κομμάτι, δηλαδή για το κομμάτι της διορθωτικής άσκησης. Η διορθωτική άσκηση είναι ένα πολύ μεγάλο κεφάλαιο και είναι κάτι το οποίο νομίζω ότι θα συμφωνήσουμε όλοι ότι το χρειαζόμαστε. Το χρειαζόμαστε όλοι εμείς οι οποίοι απλά θέλουμε να κάνουμε άσκηση ή είμαστε αθλητές ή θέλουμε να κάνουμε κάποιο σπορ ή απλά καθόμαστε όλη μέρα σε μια καρέκλα και δουλεύουμε μέσα από τον υπολογιστή μας. Η διορθωτική άσκηση, ειδικά όταν κάποιος κάνει εξακολούθηση συγκεκριμένες κινήσεις, είναι πάρα πολύ χρήσιμη, διότι θα τον βοηθήσει στο να μπορέσει ο γυμναστής να εντοπίσει τα επαναλαμβανόμενα κινητικά πρότυπα τα οποία κάνει ο ασκούμενός του, τα οποία αυτά θα έχουν δημιουργήσει κάποιες μυοσκελετικές ανισορροπίες. Άρα λοιπόν, πριν κάνουμε το οτιδήποτε, και ακόμα και αν έχουμε έναν ασκούμενο ο οποίος φαίνεται ότι είναι πολύ καλά γυμνασμένος, ενδεχομένως θα πρέπει να του κάνουμε μια καλή αξιολόγηση για να δούμε κατά πόσο αυτός χρειάζεται να δουλέψει στο κομμάτι της διορθωτικής άσκησης συγκεκριμένες μυϊκές ομάδες ή αρθρώσεις. Σήμερα λοιπόν το θέμα της ημέρας θα έχει να κάνει με τη διορθωτική άσκηση και κατά πόσο τελικά αυτό είναι μια πολυτέλεια ή μια βασική ανάγκη που θα πρέπει όλοι να την κάνουμε. So, Wendy, I said all these things in Greek. Maybe you have understand something because Wendy is half from Greece, guys. We have these wonderful people today with us. Right now, we're like 110 people. The majority of them are trainers, professional trainers, students. So, they're all yours. Thank you very much for having you here today. And we are looking forward to hear this wonderful speech.
Fantastic. Well, thank you. Thank you so much for this opportunity. And, you know, today, when we spoke with Giannis, the big conversation was about corrective exercise. And I just want you guys to realize that I am open to any questions that you have. So as I go through, I'm going to give you just a brief presentation for you guys to look at some slides. I, of course, will talk through them. However, if there is something that comes up, please put it in the chat and I will be sure to spend some time after we go through the prezo answering as many questions as I can. And again, want to say thank you guys for having me today and for taking the time out of your schedule to join us. And I'm going to go ahead and share my screen. So let me share this. And there we go. So today, our topic is corrective exercise. Is it a luxury or a necessity? And the question will always come back to, when you think of it this way, is pain, is injury, is that considered a luxury? And then the answer should be no. And so when you're thinking about corrective exercise and you think about as a trainer, how can you help someone move better, perform better, and feel better? It's always going to have a corrective exercise approach. And I think one thing that often happens is that we look at corrective exercise as something that's different than an actual workout. And in all reality, and that's what I'm hoping to share with you guys today, we really want to show you guys that it should be blended into everything that you do with the client, because most people, not everyone, but most people will come to you with some sort of compensation or movement imbalance. And if you can correct that while you're getting them stronger, bigger, you know, leaner, whatever it is, then it's a win-win for both. And so, is it a luxury or a necessity? I'm hoping by the end of this, you guys will think it's definitely a necessity. So when you're looking at corrective exercise, you want to think that when you're thinking about NASM has the OPT model. And as personal trainers, we have looked at the OPT model. And if you've taken your CPT, you're going to see that it is 5 phases. Well, I have been working with the OPT model since before it was even implemented into NASM. So I've been a part of this company for a very, very long time. And my mentor was actually the founder of the OPT model. So I feel very comfortable talking about all phases and all aspects when it comes to the model that we're going to be showing you. But corrective exercise was actually implemented into what you guys know as phase 1. And so you want to think of it as it's kind of like the intro into phase 1, because you have to have a foundation in order to build on strength and power. And so when a client comes into you, of course, you're going to get their subjective information. You're going to talk to these guys. You're going to find out what is it that they want. You're going to set these realistic goals. And then after that, you're going to look at them. So if you look at your client when they're standing there talking to you, what do you see? And so that's a great time for you to start taking some mental notes. Plus, as we mentioned, with all of this stuff with COVID, people are sitting more, they're moving less, they're not going outdoors and doing things that they enjoy. And on top of that, they're probably not doing any type of workout that they would normally do on a day-to-day basis because of the situation. And so you're going to notice that if people are sitting in front of a computer, their head's going to be forward, their shoulders are going to be rounded, their hips are going to be tight from being in a seated position. And so those are just common things that if you ask them, what do you do every day? If they say, well, I'm in front of my computer more, that should be a trigger right there to you. Like, oh, okay, I have an idea of what I'm probably going to see when I do my assessments. And so when you're thinking about, again, is it a necessity or a luxury? Well, let's see what their assessments show. And that's going to dictate basically what you're going to do with your client in order for them to be successful reaching their goals. And so we're going to talk a little bit about the overhead squat assessment. We're going to talk about the single leg squat assessment, as well as something that's kind of new into the corrective exercise, which is now we've implemented something like the split squat assessment. So we're going to talk about what that is and why that's also beneficial. And then we're going to actually show you some different things to think about on a mobility side of the game. And then what do you do with all this information, right? We get all of this information, you're getting all this stuff from your assessments. But if you don't take the information and program it, then what's the whole purpose of even doing the assessments to begin with, unless you're just trying to find out what their ultimate goal is, which is probably lose weight, feel better, get out of pain. So that's kind of the flow that you want to think about when everybody walks into your facility, or if you're doing this virtually, you can still do every assessment virtually. You can do it on Zoom, you can do it on FaceTime. You just have them set their cameras back or their phones back and have them do certain movements. You gather all that information, and then you can write a program, like I said, that's going to be very beneficial for them all together. So when we're talking about static postural, assessments, you always want to think about the 5 kinetic chain checkpoints. And I know this probably isn't new to a lot of you, but when you're looking at someone, like I said, when they walk in, you want to think about your feet should be shoulder to hip width apart with the toes pointed straight. Your knees should be in line with the second and third toes. You're looking at their hips to find out if they're level. You're looking at their shoulders in relation to like their ears and their neck. So you're kind of looking at all, like from the lateral view, you can see the picture. You're looking at the ankles, the knees, the hips, the shoulders, and the head. Do they line up? If they don't, there's a compensation there. And then from the back, do you see any shifting in their hips, or, do you see their feet turning out? And then from the front, how are they standing? Now, this is just a visual. You're not having them do anything other than how are they talking to you, and you're just taking a mental note. However, when you actually start to get into the transitional assessments, such as the overhead squat, the single leg squat, you're going to see, okay, is how they're standing and how they're moving, are there any similarities? Probably, but you don't know until you assess them. So the purpose of the overhead squat is we put every individual into the 5 kinetic chain checkpoints. We take off their shoes so we can see what's happening at the foot and ankle complex. Because as you guys know, when somebody is going in and doing an actual squat, if they have shoes on, they could have a small little lift in the shoe. And so that might be giving them a little more dorsiflexion. So that you might not see some of the compensations that you would see if they didn't have their shoes on. So that's why we ask everyone to take off your shoes, and then we set them up in proper alignment. And one of the first questions that I always get is, if you set them up in proper alignment, then aren't you kind of telling them what you want to see? And the answer is kind of, but I'm not saying anything other than, hey, let's start you in this position. And then as you go into your squats, let's just see how you move. I want you to keep it pain-free. I demo it. So I do a show, tell, do. I show them what I want while I'm telling them. I give them an example, because some people, believe it or not, do not know how to squat. So you want to make sure you're setting them up for success. And then I have them raise their hands over their head, and I have them perform 5 squats in each view. If I have them in proper alignment, as they squat down, we're going to see where they deviate. And so they can't help it if their ankles or their calf complex is overactive, their feet will slightly turn out. If there's something going on at the hips, you're going to see some deviation occurring during movement. And so all of this is very good information. But if you don't set them up in the 5 kinetic chain checkpoints, you're not really going to see where they deviate if they're already in compensations and then you have them squat. So from that overhead squat, that's the purpose. We're just seeing from ideal alignment into movement what occurs. And that's the purpose, just making notes. And that's going to help me. It gives me the blueprint on a program design standpoint. And the same thing with the single leg and the split squat. So if somebody's overhead squat is okay, but you notice that you might want a little bit more information, and it's safe, then have them do hands on the hips and go into a single leg squat. That will let you know how their balance is. It lets you know if they have any neuromuscular control. It also kind of gives you more insight. If you noticed in the overhead squat that the knees went out, but then in the single leg squat, the knees caved in, you're going to see that when they're on 2, they were really compensating, and you're going to go with the results of the single leg squat. Now, over time, NASM has noticed that it's really difficult for some people to go from 2 feet to 1 foot and perform an assessment to gather information. And so what they've come out with was kind of a way to do it where you can still get really good information by doing what they call a split squat. And that's just basically you're doing a lunge and seeing what happens. You're going to see if the knees cave in. You're going to see if they lose their balance. So it's a little safer for somebody that cannot do a single leg squat. However, any compensation that you see, of course, you're going to note it down. There are so many different assessments out there. And so you don't want to think that every client that comes in, you should always do the same assessments. And what I mean by that is I train clients of all populations. However, I spend more of my time with professional athletes. So I have to be able to get them as explosive, as powerful as possible before they report to camp or before they get into their season. So when again, I'm going to bring it back to, is it a necessity or a luxury, especially for that clientele? It is definitely a necessity when you're thinking about finding all of the information out during the assessment process, because it's going to make me more successful as a trainer, but it's also going to have better outcome results for the client. And so when I say these are optional, it really depends on the client. And so you don't always have to do some of these. However, when we're talking about loaded assessments, we're looking at the push and pull assessments, meaning somebody might not be able to squat, or maybe you want some further information about what's occurring at their upper body. So you would put them on a cable, set them up again in the 5 kinetic chain checkpoints, and have them do some pushing motions. So basically a chest press. What do you see happening? And write it down. Same thing, you're having them do maybe a cable row. What do you see? Do you see an arch in the back? Do you see their neck jut forward? You know, can they do an overhead press without shrugging, without driving their neck forward? Or when they lift their hands overhead, do you notice an arch in the lower back? Because remember, anytime the hands go overhead, it is, and you notice a low back arch, then maybe it has something to do with the overactive lat that's causing that compensation. And that's why this is really good to know, because more information you gather, the better it is. And so remember, any movement that someone does is always an assessment. When they're walking, when they're standing, when they're actually doing the assessments that you set them up for, and any exercise you have someone do, you are going to be successful because you're cueing them out of a compensation to help activate specific prime movers or muscles that you're trying to focus on during the workout. And so dynamic assessments that we have listed here, again, this is something I use very often with my professional athletes. However, I don't always use these with some of my day-to-day clients that are moms or maybe CEOs, because we don't need to know exactly how, like what their depth jump is, or, you know, because they're not doing that in everyday life. So on an assessment process, you want to think, what is it that someone does every day, and where is it that you can gather the best information? But if somebody doesn't need to be jumping off of a box, or they don't do that for a living, for instance, my NBA guys do, because they go up for layups and they're constantly jumping, it's extremely important to know that kind of stuff. But my moms don't necessarily do that. So I can probably get away with the information I gathered with the overhead squat, single leg squat, and so on before we even got to this. So remember, these are just optional, but it really depends on your clientele. And you always want to keep that in mind, and you want to make it as safe as possible for the client while you're gathering as much information to help you identify what could be over and underactive. Now, with the corrective exercise, to me, I think corrective exercise in general is what has made me successful as a trainer. And what I mean by that is I can now look at someone's compensations and I know how to fix them. And then I can get them to whatever it is that we want to try to achieve long term. And so when you're going and talking with your clients, you don't have to say, I'm doing a corrective exercise assessment with you. You're just gathering information, and let them know, hey, I'm going to try to get as much information as I can, and we're going to design the best program to make sure that you lose weight for this wedding that you want, or tying it back to their specific goal is the end game. And so NASM also has something called mobility assessments. And back in the day, we used the goniometer. And the goniometer, for those of you that are new to that, is just the human protractor, where you're measuring all these joints in a very specific manner to get ideal numbers to see where they maybe are different from ideal. And that is great. However, most trainers are not comfortable using a goniometer. I know that. I use it all the time, but I've used it for 20 years. But new people that are coming into it, it takes time to really get a good feel of, are they in the right position to measure everything out? And so this is something that's new. And if you guys haven't seen it, you're seeing it today. But when you're doing something like the weight-bearing lunge or the split squat, you're looking to see what's happening at the back foot. And can they go, and you can see this too, but basically they're doing specific exercises where you're close to a wall, they step 2 inches back, they go into a lunge, and can their knee touch the wall? If it can, you say yes. If it can't, you say no, and they fail that test. So rather than putting someone on laying down and taking a goniometer and measuring to see if they have 20 degrees of dorsiflexion, you're just having them do a lunge to see if their knee hits the wall, and it takes no time, and you will know that there is a restriction at the foot and ankle. Same thing with knees. I'm going to show you some examples of what this looks like, but you can find by just having someone lay down and go into knee flexion and extension, do they pass or fail? Do they get to a certain level? And same thing, there are so many different mobility assessments. And to me, this is a game changer because it allows someone to very quickly confirm or deny what you just saw in the movement assessments that you did prior to this. And that's the whole purpose of a mobility assessment. And what it tells you is that if someone has their feet turning out during an overhead squat, but then when you put them up and do something like the weight-bearing lunge and their knee cannot touch the wall, then you know it's an ankle and a muscle issue. It's probably overactive is more important than the underactive. If they can touch it, then you know that it's not necessarily the overactive muscle, it's the weak muscle that caused that movement compensation. And so it allows us to program smarter by taking less time to do so. And so when you're thinking about the importance of mobility assessments, this is what we're looking for. Do they have proper dorsiflexion? Do they have adequate knee flexion and extension? Do they have multiplanar hip mobility, lumbar mobility, and trunk mobility? Meaning, can they move? And if not, what's moving for it in order to make that movement happen? Because remember, if a joint is restricted in your body and you need to squat, you're still going to squat. But what are you taking away? Like, what's not functioning ideally to get the proper movement in order to make that squat happen? So that's one of the things that we're looking for. We're trying to see, is it more of the overactive? Is it more of the underactive? And what should we focus on first? And here are some examples. So when I was telling you about the weight-bearing lunge, this is the example that I'm talking about. This individual's got her shoes off. She's 2 inches from the wall. She leans forward and she would, quote, pass because her knee does touch. A knee extension, you just have someone lay down. You don't have to touch them. And I know in the United States, depending on the state license, that sometimes there's certain things you cannot do unless you hold a manual therapy license of some sort. And I know Greece, I don't know the difference between the states as well as what you guys have in Greece, but it allows me to say, without having to touch them or get close to them, I want you to lie down. I want you to extend your knee and let me see what happens. And if they can straighten their knee, then you know that it's more of the underactive muscle. If they have a big bend in the knee and they can't get into knee extension, it's a fail. So you know that you really need to work on the overactive muscle that's limiting range of motion in that joint. Same thing with lumbar flexion. Can they touch their toes? That's an easy one because it lets you know, is it a hamstring? Is it the low back? And then internal and external rotation of the hip and shoulder flexion. So these are just some examples where visually, like for example, on the hip internal rotation, when they're laying on their stomach, you just have them bring their feet together and tell them to go out to the side. And you're going to look to say, okay, is it about 45 degrees? Yes or no? Because corrective exercise really is more specific. And that's what differentiates us from all other trainers out there. Because if you can do the corrective exercise, do it quickly to gather the right information, you really will stand out from other trainers that may not have as much knowledge of identifying what exactly is causing a compensation and what is allowing a compensation. And so the assessments to me is the most important thing because this is where you get the information in order to design whatever program you want. So is it a necessity? I would think so, because we move in a way that we want to move in an ideal range of motion, right? We need to ideally function as optimally as possible. When there are compensations that exist, that's what's going to lead to synergistic dominance. It's going to lead to muscle imbalances. It's going to lead to restricted joint movements that can then lead to pain and discomfort. And that's, as a trainer, why we probably got into this whole business, was to make sure that we help people get out of pain and hit specific goals. And so, as you can see, I'm super passionate about the assessment part because I believe that if you can identify something quickly, you're not spending all day doing assessments. Just choose the ones that you feel are going to be the confirming or denying what you saw in the overhead squat or single leg squat. Then it's just more bang for your buck at that time because these are easy to do and they take no time to do it. So again, when you're thinking about your mobility assessments, you want to just see what type of assessments would be most ideal to gather the information you need. Always make sure that you're setting everyone up in the most ideal form as you possibly can. Then again, no. Can they do it? Yes. Can they not do it? No. It's just a pass or fail. You're not spending a ton of time. Can they straighten their knee? Can their knee hit the wall? Can they bring their arm over their head without bending the elbow or shrugging or something? If you see a compensation, or they fail because there's movement coming from somewhere else, it's a fail. And so at that point, you want to just mark it down, and then you have all this information. And so now what do you do with it? That's the big question. And I think this is where people sometimes get hung up because they think that corrective exercise is different, and it's not. Because what you're doing already in your programming is probably corrective exercise. It just may not be as specific as it could be. And I think, again, that brings back the importance of corrective exercise. But guys, corrective exercise is the same thing as exercise, because at the end of the day, you're trying to get muscles to fire. Corrective exercise just ensures that you're making sure the right muscles are being activated and you're stretching the muscles that are causing those compensations. That's the only difference. So it really shouldn't be two separate things. You really need to understand that integrating and blending your programs will be so beneficial to you as a trainer, but then also to your client as well. So I wanted to do a case study with you guys, and it's kind of just to follow along to make sure that this even makes sense to you, okay? And so we call it kind of like the breadcrumb trail. And what that means is basically, if you have someone and their feet turn out, and you're like, okay, and they're complaining about knee pain, pretty common, then do an overhead squat, okay? If you want to do a modified overhead squat, then you would just get let's say a plate, so like maybe a 5 or 10 pound plate, and put it underneath their heels, and then have them do the exact same thing, but you now gave them dorsiflexion. And so if you're trying to figure out if it's specifically the foot and ankle complex, then during the overhead squat, their feet would turn out. So that would be a confirmation that they would, quote, have a compensation because you saw it. If it cleaned up during something like the elevated overhead squat, because you gave them a few inches in order to move in their ankle, and their squat actually looked better, that's pretty much an indication you want to spend more time on the foot and ankle complex, because that's what's probably leading more to the knee pain versus the hip. Because remember, guys, the hip joint is kind of like, the knee joint is kind of this not so smart joint. It does what the foot and ankle or the hip tell it to do. And so if one of those two are not functioning properly, you're going to see some issues happening at the knee. And it just unfortunately takes the hip a lot of times. So the weight-bearing lunge test, that's the one that I just showed you with the wall. If their knee touches the wall, then that would be a pass. However, if it doesn't, then it failed. So again, it's confirming that it's the joint that's pretty much overactive. The knee, again, people often say, well, my knee caved in, my foot went out. Just do knee extension, because if they fail knee extension, which means, again, that's the one they're laying on their back, they try to bring their leg straight. If they can do that, then it's definitely at the foot and ankle. However, if they fail that one and there's still a bend in the knee, then it actually will say, okay, it's the foot and ankle and the short head of the bicep femoris. So, because think about the bicep femoris, it's the short head of the bicep fem. And so that's the one that actually attaches from the back of your hamstring and crosses the knee joint. And if it's super overactive because of where it crosses and inserts on the lower leg, then it can cause that foot to also externally rotate. And so it's a confirmation that you know that that also is playing a very big role in what you're seeing. And then again, just passive, internal and external rotation just confirms or denies. So this is now the breadcrumb with the corrective exercise program. So when you're thinking about this and you're going and you're designing this program, okay, when you inhibit a muscle, you're going to use the foam roller. You may use the new foam rollers out there with vibration, which again, vibration has also shown in research to be very positive. But what you're trying to do is you're trying to inhibit a muscle that was shown to be overactive. And so sometimes people get taken back because they're really unsure about anatomy. I don't know the origin. I don't know the insertion. I'm not sure. That's the beauty of what NASM offers, because they have something called the solutions table. And I actually have an example. This is what it looks like. And so that solutions table it tells you, if you see this compensation, then foam roll this, stretch this, and activate that. And that will allow you to become more comfortable to be able to rattle some of this stuff off that I'm saying. And the more that you get used to, utilizing the tools that we have available and implementing it into your program, again, the easier this stuff becomes. But people oftentimes get super stressed out because they feel that they need to know that because this muscle does this movement and inserts here and inserts there, that if you don't know the exact names and locations, that you're not going to be successful. And that is not true. It's you having an idea is important. And knowing the function is extremely important, but don't get caught up right now on that. Just think about what's causing these compensations and what muscles allow that movement and go with that. And so when we talk about inhibit, we're foam rolling. We are literally trying just to relax a muscle. We're trying to get more blood flow, more circulation, everything to that overactive muscle. And then we immediately go into lengthening by static stretching a muscle. And remember, when static stretching has gotten a bad rap by a lot of other people in research, and the reason being is they're probably not statically stretching the muscles that have shown to be overactive. For example, in research, you're going to see a lot of people do the hamstrings. And we just talked about, because of COVID, everyone's in a seated position. And if you have, and you stand up and their hips are tight, then it's going to pull your hips forward and your hamstrings are actually in a lengthened position. If you feel them, they feel tight. But if you have a string and I have an end of a string and we pull and you can pluck it, it feels tight. However, it's not. It's actually in a very lengthened state. And then let's go and add a static stretch. That doesn't make sense. That's actually what leads to strains and pain in certain areas. So by identifying the muscles that are in a shortened and overactive state, which is the whole purpose of the assessments, it tells you, hey, feet turned out, look at your assessment or the solutions table. These are the muscles that were short and tight. Just stretch them. What you're trying to do is get optimal length back into that muscle that was in a shortened state. And what that does is help realign the actual joint from end to end. However, just because you foam roll something and you lengthen something that's overactive, if you don't take care of the other side that is in a lengthened position that actually allowed that compensation to occur, then you're really not going to realign the body the way that you're hoping. You're just stretching one side, getting length back, but then the other side's super weak. So it's like, eh. And as soon as you go back to doing life, it's going to tighten right back up because you didn't work on strengthening the side that allowed that compensation to occur. And so when we talk about activate, we're activating the other side that was shown to be weakened, like in a weakened state. That's what allowed that compensation to occur. So for example, with our feet turning out situation here, the gastroconsolius and the short head of the bicep femoris were overactive. So we're going to foam roll and lengthen those three areas. From there, you're going to think about the other side of that. So the anterior tibialis, the medial hamstring, as well as the medial gastroc, so the medial calf complex, because remember, feet go out, the medial side's going to be weak, the outside's going to be overactive. And so when we're talking about lengthening and inhibiting here with the overactive side, we're focusing more on the lateral side. And then on the activation, we're going to focus more on the medial side. And so when you're thinking about, okay, now we've lengthened the overactive side, we're activated the weak side. Well, now you got to teach your brain and your body what to do with all this. And so that's why we go into integration. And so if you follow the NASM, thought process, this is the exact same thing that you do in phase 1, is you're preparing the body for movement. And so when you look at integration, you're teaching your brain and your body now how to move with that newfound alignment on the joints. And so a front step up to balance, a single leg balance with reach, or hopping. Those are just some examples. So you could do this with your client, and then you can go into an entire workout. Or you could just spend time showing your client how to do this, and this could be their homework. Again, you're not saying, hey, this is a corrective exercise program, I want you to go home and fix yourself. You're saying, hey, these are some things I want you to do at home, or these are going to be some of the first things that we do before we get you moving on, just to make sure your body is working the way that it needs to in order to execute these other exercises correctly. That's all you have to say. Don't bring in all this crazy corrective exercise stuff, because you're just preparing the body. That's all you're doing with corrective exercise. You're just being very specific. So this is an actual corrective exercise program. As you can see, it should not take very long. But with me, and again, with my clientele, I don't do just this. This is just their warm-up. So I wanted to show you an example of how do you blend a corrective exercise into an actual workout for someone that is going to specifically focus on the foot and ankle complex, because that is where I know their problem where it lies, based on everything that I gathered during the mobility assessment. And so before I show you the blending, I want you to think of it this way. No matter what, femoral areas that are overactive, stretch the muscles that are overactive as well. Activate the weak muscles. And then choose 2 total body exercises. So when we're talking about integration, it could be a ball squat, bicep curl to overhead press. It could be a step up to curl to overhead press. Make it an exercise that integrates the entire body. And then as a trainer, make sure that they maintain proper alignment. If you notice that their knee keeps caving in, give them a cue. Touch them on the outside. Show them that it can be done. Try to work on activating those muscles, which hopefully you just did in the activation section, so they're firing the way that they were intended to fire. And then after that, focus on the body parts. Go into your workout. Whatever you were going to do with your client, just add these few things above it. And then always don't forget about the cool down. People are like, oh, okay, I'll do the cool down later. And you and I both know that if you don't see them stretch or roll or something and they walk out the door, they're done. They're not going to sit there and say, oh, I need to do my cool down. When in all reality, you want to think the purpose of the cool down is to realign the body back into its ideal state before they come back in and see you again. So it really does play an important role. And remember, all programs need to be individualized and progressive. And, when we think about all of these crazy workouts that you see on YouTube and everything like that, you want to keep in mind that there may be some fun exercises that you can integrate into your workout, but just because they seem fun doesn't mean that it's going to be beneficial to your client. So you just want to be very smart in your exercise selection and always have a rationale as to why you chose that exercise. Because if I was your client and you had me do something that I thought was weird, I would say, why am I doing this? And I would hope that you would have a very clear reason for why you were choosing the exercise that you chose. So how do you blend this together? Well, this is an example of a workout that you could do for someone that has compensations. Again, foot and ankle compensation is a big one. It's very, very common. And so as you can see, the lateral head of the the lateral gastroc, the short head of the bicep fem, and the TFL. You could just have them come in, foam roll those on their own before you even start their session if you're worried about time. However, I can guarantee if you follow this, you can get this done in 50 minutes or less. That gives you 10 minutes to still be able to transition, still be able to do the, whatever it is that you want to do. So just know that this actually could be done in less time too, depending on the rest period that you chose for your clients. But this is with somebody that does have rest in between each section. And then if you have someone, as you can see, it is a blended CES into a phase 1. After they foam rolled, I would have them statically stretch. And then I would have them do inchworms. It's a dynamic stretch. It can be done in phase 1. And again, I'm still working on dorsiflexion of the foot and ankle complex. But it's an actual exercise that we do for dynamic warm-ups. Then under activation, think of activation as your core. And so you want to think, when you're thinking about core and balance, the whole purpose of core is to focus on those little muscles that protect the spine, but also activating those muscles to realign the body. And so turning your toes in and doing calf raises will really focus more on the medial side of the calf complex. So again, think about your tempos, because most injuries occur when you're decelerating. So you want to think you're going to come up for 1 second, hold for 2, and slowly lower yourself back down for 4 seconds. That is the tempo for each rep that you do. So therefore, you're getting that muscle to really activate the way that it's supposed to and learn to control itself when you're decelerating into movement. And so anterior tibialis, you can do that with the cable. You can do it with the tube. You can do it at home as well. They'll just have to wrap the cable around something lower and then bring their, make sure that you've got a good foundation that the band will stay on top of their foot. But anterior tibialis movements, so they're just bringing their toes up to their nose. And then the floor bridge, get glute activation. It is fantastic. And the glutes are usually a common weak muscle, but it's also your powerhouse. And so the floor bridge, the ball bridge, any kind of bridge is fantastic for a phase 1 exercise. As soon as you go in, so again, you're done with your foam roll, you're done with your static stretches, you've warmed up. What I commonly do personally is I make this a little circuit. So I would go calf raise, anterior tib, floor bridge into a squat jump with a stabilization hold. And I would have them repeat that. So they go calf, anterior tib, floor bridge, squat jump, and then repeat. And think of activation and skill development as an extended warm-up. So we haven't even worked out yet. I tell them, okay, this is just a warm-up. And I get that look like, what? Because if you were very specific in form, tempo, and execution, this should be challenging for someone that has compensations. And so we do that twice. And then after that, I'll be like, okay, let's start your workout now. And then as you can see, we go into the body parts. A standing cable chest press. Okay, I usually put them in a staggered stance. And if they are in a staggered stance, I usually put them into triple extension. So I'll actually have them up on their back toe where they have to squeeze their quad, squeeze their glute, maintain proper alignment in their core, and then go into the press. Again, still focusing now on the foot and ankle complex to make sure their feet stay perfectly lined up in the kinetic chain checkpoints. Then go into a single leg cable row. Again, working on foot and ankle. Think about the balance. We're making sure that they don't drop in or pronate on their foot. So we have good strengthening going on at the bottom of their foot while we are also working on their back. When you look at the ball prone cobra, so you're face down, if they're on a ball, again, I put them into triple extension against a wall. I don't have them floating out in the floor. And so their toes are in basically up into the floor and wall where it meets. Their quads are really tight. They're squeezing their calves. and they're squeezing their glutes, drawing in, and then we go into the Cobra, which is a very good mid to lower back exercise. So we're focusing on mid to lower traps, as well as maintaining proper positioning against gravity. And then the step up to balance, again, foot and ankle, amazing, working on quad and glute activation. And so as you can see, it's still coming back to our compensation, and we're working the little muscles while working on specific prime movers. So technically this is a corrective exercise program, but as you can see, it's a phase 1 program that's just blended into anything. And then the single leg balance bicep curls, everyone's all about the gun show. So throw in a bicep curl, give them something they want while you're giving them something they need. And then again, after that, we'll go into the cool down. And so I do this chest, back, basically back again in a different way, and then legs, and then biceps. I do that in a circuit fashion. And so oftentimes people are like, well, what if I've got a client that wants to lose weight? I'm like, fantastic. Then after you get done with the bicep curl, put them on a rower, have them row as fast as they can for 15 seconds. Put them on a bike, do a quick sprint for 15 seconds. Take them outside, have them walk up and down the stairs, making sure their feet stay straight. Whatever it is that they want to do, you can do what I have termed a metabolic blast in between to get their heart rate right back up. Give them a quick second to come back down, meaning like they cool down, grab some water, and then we repeat it again. What ends up happening is people talk too much. Like, focus on the program, focus on your client, and then at that point, see what's in their best interest. And then at that point, it's a win-win. You're losing weight, you're actually correcting their body, they're feeling better, they're moving better, they're performing better, and they will reach their goals because you're going to work them up into a progression on the model into the phases that best suits their needs. So the key takeaways, and then I'm going to open this up to questions, is basically the assessments is a vital first step for creating an effective program, not just a corrective program, but just a program in general. And that movement quality relies on optimally functioning, occurring during the human movement system. Everything should fire at the right time and the right plane of motion. Like, we're working on neuromuscular efficiency. And it's just a fancy way of saying you want your body to function correctly. And you can make that happen by implementing specific workouts that's going to benefit your clients. Make sure, again, the results drive your programming. Focus on your technique. Do not ever sacrifice your form for a number, because ideal movement is going to lead to ideal execution, which will decrease the chances of injury. And think of your brain as a computer. And the more you program correct information in, you're teaching good programming. As soon as you let your form fail or you teach a compensation, your body's going to hold on to that, and then it's harder to break later on. And so again, think about the corrective exercise continuum to optimize every movement that you can do, and it really will lead to a higher level of performance for any client that you have. Again, for me, to the highest level athlete, as well as my mom that has to chase after like little people. Because if you guys are a mom, it's really challenging to be able to multitask and have have children around. So no matter the clientele, this can be very, very beneficial. And I hope you don't see it as a luxury, that you see it as a necessity, because it really will make you a successful trainer if you just think about the concepts and what you're trying to achieve to have better movement patterns.